Director of Kenya Institute of Business and Counseling Studies, what we call KIBCO. Daktari, karibu sana. This is Apollo staff. We are all eager here to hear from you this morning. I know you are ready. We are ready. We are here to support you in case you need any support on the technology. We are also on this other side as your host to take care of you. So, Daktari, if you can unmute so that we check if we can hear you, please go ahead and unmute.
Can you hear me, Jemima?
Yes, I can hear you. Just a little louder.
Right. You're
Yes.
hearing me proper now?
Yes, I can hear you very well.
Okay.
Yeah.
Sawa, sawa.
Please, karibu, go ahead.
All right. I'm very appreciative of this particular session where all of us are going to be basically reflecting on mental health, and especially when it comes to mental health in our workspaces. That's what we are going to be looking into. And just like you've been told, I'm Catherine Gachutha, and I am a counseling psychologist and the chair of Kenya Counselling and Psychological Association, which is the umbrella body of the counseling standards in the country. Now we have a board that licenses the counselors and psychologists called the Counselors and Psychologists Board. But the professional bodies are supposed to take the lead in making sure that counselors are developed just like other associations do. But much more working with the Kenya Institute of Business and Counseling Studies. And this is the institution that provides counseling services or psychosocial services to APA. I am going now to be sharing. I'll actually put off my camera and start sharing. I hope, Jemima, you can see that so that Jemima, can you? All right.
We can see yours.
Yeah. We are looking at relationships and mental health, and that is what we are going to be breaking down as we go along. Some of these things you know, but it really helps to have a reminder, because there are many times that we as human beings will forget the very critical aspects of our own lives. And so a refreshment and a reminder, or even something new that comes to you, is very critical, so that we can be able to take care of ourselves very well. Mental health and physical health, they are interconnected or have a bi-direction and very complex relationship. And when you are physically not healthy, there is a way in which even mentally you're not healthy. And the World Health Organization defines health as a state of complete physical and mental and social well-being, and not merely the absence of disease or infirmity. We, in our cultures, in our different cultures in this country or even in Africa, we actually know or assume we know the persons that are not mentally healthy, the ones that we see across the road, dressed not in a very conventional way, or they are correcting papers along the way. Those are the ones that we tell ourselves they are mentally ill. But we also know that we have different kinds of mental illnesses which do not put people in those kind of situations that we know very well. And therefore, when people are not able to physically and mentally and socially and spiritually feel that they are connected with themselves or they are okay, then that means that they are not healthy. And so you don't only look at one aspect. Like, for example, are you having self-care? And if you're having self-care, what do you do? You may be a very senior manager in your organization. And because of that, you tell yourself, I do not have time to take care of my physical health. But no one else can do that for you. You are the one to make sure that in your structuring of the things that are important for you, that physical exercise, or even other aspects of mental health and self-care, that you are going to prioritize that. You may also realize that you don't relate very well. You keep on pushing people away, or you're very aggressive with people. You are a manager, but your aggression is in another level. And even the ones that are your direct reports, they keep on mentioning that you're too aggressive and too angry and too irritated to help them to be able to become better workers. Or those that are reporting to you are the ones that are exhibiting these kind of symptoms or these kinds of signs. And so you know that this person is not well. They are not in where we can say they are in the normal age. There are many times that we know we are not in the normal age. Maybe you've been triggered by different aspects. It can be an aspect of marriage, an aspect of family, an aspect of work, an aspect of your spirituality, an aspect of environmental factors, an aspect of your finances. All these aspects and more can tilt your balance, so that you realize you are not the person that you know that you are. We say there is no health without mental health. And I don't know what comes to you when this statement is made. There is no health without mental health. And I would want us to think a little bit about this. What does it mean, there is no health without mental health? You can do that in the chat to respond to that. What you understand, there is no health without mental health, then I'm going to read it out. Or you can even say it. You can even lift your hand and say it, or raise your hand and say it, so that we can actually have a clarity of what we are referring to. There is no health without mental health. What does it mean for you? Just write it down. Sometimes it's not about correctness, but it's about those reflections that we make. So I'm giving you a moment of reflection. There is no health without mental health. Jemima, you can even start us off.
I'm writing on the chat box.
Yeah, but you can say it now that you're talking.
So my understanding is that mental health is a state of your mind, and the mind controls everything in your body, in your system, your actions, your behavior, your conduct.
Yeah.
Therefore, if your mental status is altered, maybe unstable or in a disordered way, then everything else about you is altered. Everything about that person is altered. That's my understanding of mental health.
Yeah. And what you're saying, Jemima, is that mental health is at the core of our well-being because it is central and it's connecting with all these other aspects so that when the aging is affected, when the mind, which is the aging, is affected, then everything else gets distorted, everything else gets affected because of that symbiotic relationship. And Caroline is saying to everyone, we require a sound mind to be healthy, meaning that all of us have to know we have to guard our mind with all we have. Even when things are not working, are at their worst. And I want to imagine that some of us who are here have gone through some experience that is not so good. You may have lost a loved one, someone who used to give you sobriety, and someone who was to go to person. And this does not put you in a very good state. Again, Lois is saying your mental attitude and state defines you and your everyday life. Yes, when we are attentive to the functioning of our minds, then we are very sure about the outcomes and about the products, whether it is work or everything else that happens around us. A friend of mine told me that she has no time for keeping enemies. And that I couldn't respond very quickly because all of us have gone through hurtful moments with certain persons. They can be from the family, they can be from community, from faith institutions, from workplace, friends of yours. And that statement is really deep. But she is saying, even when she realizes that things are not working, she's not a doormat to still reach out and say, hey, we are human beings. We hurt each other at that moment. In the fray of things, we did it. But we don't have to be stuck in there. And I thought, yeah, as an insurer, and an insurer that I see all the time being highlighted as a best performer, then I can see where one is coming from. And so when Beth Mainge was saying that our productivity is assured when we are able to guard our key resource, which is our brain and what happens in there. And Edna Onimo is saying our brain is the engine of our bodies. You put it very well because it is the engine that is giving all other aspects or all other organs what they require for them to be able to function. Our brain is critical, is that critical? We therefore use our minds to think, to interact, and to plan. And you are very right, Edna. We use our minds to think and to interact because you can tell yourself, I don't want to interact with David Muma. I don't want to do that. And therefore, if our mental state is compromised, if our brain structure is hijacked, or if our brain is hijacked, then we cannot function as well as we would want to function. The brain, Judy says, is the center of operation of the whole body. And when it is not okay, then the whole body cannot be okay. And so the question that we may want to ask ourselves is, how much attention do we give in making sure that our brains are going to be operational? When it comes to our vehicles, when our vehicles are malfunctioning, we make sure we take our vehicles to the garage. We even say, I do not want to touch that vehicle. It's not working very well. It can be dangerous to me. And we would want the mechanic to go and diagnose for us what is happening to that vehicle. But imagine how much reckless we are when it comes to the brain. And it is not one person, it's me, you, and maybe all of us, how reckless we can be when it comes to the kind of care that we have to our minds. And Dalton is saying, hi, to me, we need to train both of them light. A strong and steady mind is nothing without a strong body. And you're very light, because we need to see the connection between the two. And that is why we say there is no health without mental health. And we need to see a synergetic relationship, but the mind is the one that is still reminding us, because the mind will help you to think, I need now to plan for this month. I need to plan what I'm going to be doing this month, the self-care activities that I need to have. And therefore, the mind is still very central to all these things. And therefore, mental health is far more than the absence of mental illness, and has to do with many aspects. How to feel about yourself. How do you feel about yourself? How do you feel about other people? Do you feel that other people are doormats? Those that are your direct reports are doormats? Do you think that the ones that you're reporting to do not require any respect? Do you feel that your parents are nothing to look up to? That you don't have to receive from them? They do not know what they do? They belong to an old dispensation, and you are in a conventional dispensation, and therefore there is nothing you can draw from them. What we think about other people, what we feel about them, and how we are able to meet our own demands. Are there times that you feel that you're not able to meet your own demands? What do you need to regulate so that your demands and your resources are going to feed on it or onto each other? Yes, mental illnesses. This is a group of mental disorders that causes severe disturbances in our thinking. And when you're feeling like, I don't like this work anymore, then the feeling you have may be one of anger, it can be one of frustration, it can be one of sadness, meaning that whatever you are thinking has a direct connection to your emotions and to your relating. And I know there was a time we were looking at mental health and emotional intelligence. And emotional intelligence has to do with you connecting with yourself, with your own emotions, and understanding your own emotions and being able to manage them. And at the same time, being able to identify the emotions of those that you work with within the same division, within the same unit, within the same section, and being able to manage without dismissing them, without withdrawal, without avoidance, without being condescending to them, that you know they are part of your system, and no component within a system needs to be ignored. When we ignore an aspect of the system, there is a way the system decides, I'm now going to malfunction. I'm now not going to work very well, and I'm not going to give you the services that you require from me. So people with a mental illness often have difficulty with daily life affairs, whether those daily life affairs are about responsibility to significant others or responsibility to meeting your own needs and meeting the needs of others that are dependent on you, and doing well in your workplace so that you can be able to deliver and deliver better. And so I'm being told I am losing my network, and thank you so much. Am I hearing that my screen is not sharing? So let me get back. Sorry for that. I hope I'm well connected. And I can share again.
Doc, we can see your screen.
You can see my screen.
Yes.
Okay, because yeah, I was told it's not
It
sharing.
was it was a bit of fluctuation, but it's okay now.
It's okay now. Thank you. Okay. Right. Mental illness can occur when the brain or part of that brain, because the brain has many parts. And because we are not dealing with the parts of the brain, I'm not going to get into them a lot. But we know that the neocortex is very important part of the brain in terms of helping us in our reasoning. And when that is not working very well, or even when the brain is working in the wrong way, then we start having problems. And sometimes when you feel like you're not understanding yourself, those are the times that you need to see a therapist, or you need to see a psychologist, or you need to see even a psychiatrist to help you to be able to order yourself, or to put yourself to order, because that is a necessity that you can put so that you're thinking and you're engaging with your thinking is okay. When the brain is not working properly, one or more or more of its functions will be disrupted. And it's good to know, like when your brain is malfunctioning, that your greatest task at that particular time is to make sure that you will know what part of my brain is not working properly. Maybe you are thinking, maybe the way you perceive situations, and maybe someone has given you feedback and told you, would you rethink that again? Would you relook at it again? It seems like the way I see it, and the way you see it, and the way other people in the family are seeing it is different. Maybe it is a part of the brain that controls your emotions. Maybe you are signaling, maybe the physical aspect of your functioning, or even your behaviors. You're not looking at how your behaviors are very costly for you. So the not working of the brain would be injurious to you as a worker. And therefore, it's important to look into it and make sure that you are monitoring yourself properly. I want to move the slides in there. Right, thank you. Right, let's think a little bit about relationships and mental health. What is the connection? Because our topic is on mental health and relationships. Healthy relationships, like even in the workplace, when a workplace, an organization, is careful about how relationships happen and what people feel about each other, then their mental health is taken care of. You can even see the satisfaction You can see the joy. Sometimes it's not even how much you are getting, but how much you are made to feel. What does the organization or your organization make you feel? If it makes you feel great about yourself, maybe the validation, the motivation, the being allowed to be creative around your work, not feeling like you cannot think on your own, you cannot do things differently because someone would want you to do things in a mundane way that has always been what has been done before. And people who feel meaningfully connected and who have healthy relationships in their life, they are in a much better position to access help when needed. I repeat again, people who are meaningfully connected. And we are talking about people in all sectors. It doesn't matter whether it's community, in your faith institution, in your workplace, in your family, in your marriage. Do you feel meaningfully connected? Do you feel like the relationship that you have with those significant persons is a healthy relationship? On the other end, unhealthy relationships can contribute to mental health issues and challenges. And a person's mental health can affect how they interact with people in their lives. If you have major depression, then that means that you don't have energy even to talk, energy to eat, energy to dress, energy, even the sleep is disrupted, many things are not working. When one's mental health is affected, then all aspects of life are affected. How you relate with parents, with peers, with partners, with teachers, with co-workers, now gets dramatically affected. And I want us to discuss just a bit on what are some of patterns of relationships in workplace that can actually be very costly, that can cause people to have mental illnesses. What are some of the relationship patterns that can get us to that level? And that can go across board. It can even be how significant others in your family relate, how people within workplace relate. They may be bosses, they may be direct reports and others. They may be parents, they may be children. They may be how the siblings relate with each other. There may be other institutions that you are a member to. What are some of the relationship patterns that are very costly? I am checking now the chat. I have combined all of those so that we don't seem like we are talking about our workplaces, but we are talking about relationships, and that can happen anywhere. What are those patterns? Beth Mange, you can start us as the others are typing. Yeah, Lemmy Wanjara is saying, when we lash out. And how many times do we lash out? Don't we lash out even at our children? Yes, when we do lash out,
profitable in terms of discussing your issues with whoever. Hello?
Repeat again, Beth.
So what I was saying, Professor, is when you're at ease, when there's trust, especially in any relationship, then it helps you to be vulnerable. It helps you to have clarity of thought. It helps you to share your, your ideas, your views. So it's very important to just always, even as we speak about our mental health, to also work or stay in environments where we're cultivating trust amongst ourselves, whether in our work relationship, whether at home, whether in all those scenarios that you've shared with us. So to me, I would work also with, how is it, what is it that is within me that can help me to cultivate a trustworthy or an environment that encourages trust, so that there's honesty in the conversations and in the relationship.
Oh yeah, oh yeah. And that is very important. People who allow you to be vulnerable, people who allow you to say anything and you're not judged. You're not judged in a particular way. You are allowed to be human, and sometimes not get it. Because we human beings, there are times we are getting it very well, but there are times that we are not getting it. And we have to ask, I'm not getting it. Can you repeat it to me? And so when my boss is lashing at me and saying, go away, are you daft? Then that means that I cannot be vulnerable. I think that's what Beth is saying, that environments where you can feel, you can trust, you can be anything, you can be yourself, and you're not going to be seen in a particular way. And Ian, there was Ian. Ian, you wanted to say something, and I'm giving you a chance to do that. Your hand was up, Ian. If Ian is not Lady Edna, let me has added avoidance. That avoidance, yeah, is a pattern that does not help. Gaslighting, that the problem is turned to you. You know, people are not taking responsibility of their own actions. They would want to return it to particular persons, and you don't feel that that is kind. A condescending attitude where you're looked down upon, or yelling and always exploding over a very small issue, Loss says. The reverse psychology mechanisms, that is a gaslighting. Yes, and it's Edna who is explaining it to us so that we can get it in a better way. Those kind of behaviors, whether we are exuding them in relationship to our children, or in relationship to other family members, or in relationship to others in our workplaces. And because we feel we are bosses, then we can lord it over other people. And because we feel we are juniors, we can behave the way we want. It is all of us within the community, in our workplaces, to make sure that whatever we do, how we do it, and what we say is creating an environment of safety, as Jemima was saying, that environment of safety, so that all of us can feel that this is our place to grow and to multiply it. The exclusion, when people are excluded and they are not given the reason as to why they have to be excluded, it doesn't feel very well that you are the one to be excluded and you still belong to that workplace. You'd want to feel and so to have, like supporting, encouraging, and we can support the ones on top or the ones down or the ones across at a horizontal level, listening and accepting and trusting and respecting and negotiating differences and deciding that you can mentor, you can make other people to be better. That is going to actually help you even into the future, because you are ready to grow and expand others rather than always getting irritable at them, that you can grow them. Because when you become irritable and you are the boss, know that you have the power to damage and power to destroy and power to remit and power to disable. The same way, when we are discharging it on our children, that we still know that we are doing the same. There are characteristics of good health, and such characteristics of good health, they include feeling good about ourselves, feeling comfortable with other people, that you're not feeling like you cannot stay, you cannot work with other people. That's not what you feel, that you cannot, you're not comfortable when you're working in the same section and unit with so-and-so. Some of these things are not things that we determine, because even an employer, even when you are employing and you're doing your due diligence in selecting the kind of people who are going to add value, there are certain things that you cannot determine for sure, that you can like control everything that people are. Again, another characteristic of good mental health is able to meet the demands of life. We said that, and expressing emotions in healthy ways. Allow me to get back a bit, the demands of life. Life has a lot of twists and changes. Like, imagine that something happens and you're transferred to another department or even to another town, but that is the time that your parent is sick and in the hospital, and you get crowded, you
Professor, we lost you.
Let's track her down.
Okay.
I am back, Jemima.
We lost her. Yes, you're back. We had lost you.
Yes, internet sometimes can be very crazy. Right. We were talking about what do you do? Do you approach your boss because you've been transferred to another town and your parent is sick? Express your emotions in a healthy way. Even when you've been transferred and your parent is in the hospital, gather yourself so that you can communicate your emotions in a way that respects that other person, that boss, in a way that also helps you to be able to negotiate. Because when you're in control of your own emotions, then you can be able to achieve a lot out of a transaction that you are making. You are optimistic. You use healthy skills, that is stress management, decision making, your conflict resolution is on point. You use the I messages. I realize it's going to be very difficult. If you can allow that you give me maybe a month I see my parents in the hospital. I happen to be the main caregiver. Just give me any other task that you'd want me to do, or even consider me at this moment. I will do my work, but allow me not to leave the station at this point, because I will still be distracted if I go away. But I'm not saying that I'm not going to do my work. I will still do my work, assuring your boss that you still be in control, but you're requesting a favor so that you can be able to handle a very pressing issue that has come on board. A person who copes and adapts with changes, and you are assertive, and you are an active reasoner, you allow people to complete what they are saying. If they are talking too much, then you can say, would you complete what you're saying so that I can get in and explain a bit regarding the issue that you have brought on board. But even the way you are cutting in, it has to be in a way that you're respecting the other person. Remember, emotional intelligence has to do with managing other people's emotions, even as you are able to manage yours. And you're motivating yourself to exactly. Yeah. So again, you can be part of a team and you're not getting distracted. But we have poor mental health. You do not share your feelings. Your emotions control your behavior. You can flare up. You can slap someone. Or you find yourself being very pessimistic or ignoring problems. Yes, you can see there is a problem. You can see the persons that report to you are not finishing their work on time, and even the work that they are doing, you can see it's mediocre. That's not the way it was before, but you are ignoring that, and yet it's a very important performance aspect of you as a manager. You cannot accept change. You let stress control your life. Like, those are the times that you're not going to work, but you're not looking at yourself and asking yourself, how do I manage me so that I can be able to do all the activities I need to do in all the domains of my life? You use your messages, that is the blaming, the escalating. And like we said before, you are gaslighting. It is the reverse psychology, as we've been told. Having a lot of aggressiveness and passiveness, that there is a call of duty, the duty to care. Maybe to care for your parent, or to care for your child, or to care, or even to make decisions with your wife. But you become aggressive for no apparent reason. You are being called upon to make a decision. Then what you need to do is to ask yourself, what is making me aggressive? Is it because I'm being told and that I didn't come up with it? Is it the reason as to why I'm getting aggressive? Or even passive, that you put away, that you avoid, that you withdraw at a particular moment when that is not the strategy that is appropriate, because there are going to be outputs that are going to affect somebody, or affect growth, or affect continuity. That you can be depressed, you can learn from conflict, or you can be close-minded, or you learn the group All those are aspects of poor mental health. The dimensions of wellness are many. They can be physical. When your physical health is not okay, and someone said there needs to be a balance, or there needs to be a recognition that many aspects matter. The physical, the intellectual, the emotional, the spiritual, the environmental, the financial, the occupational, because you need to survive, the social. And you may ask me, what about some of us that are atheists? And we do not think that some of these things matter. I'm not talking about religiosity, but our spirituality can be about your values, because all of us, we have our values. All of us have beliefs, and where there are beliefs, where there are values, then that's spirituality. Because it is in spirituality where we would want to do good, where we would want to be a true stick, where we would want to be seen to be ethical. All those aspects are aspects of spirituality. They can also be aspects of morality. They can also be aspects of ethics. All of those can be kept together in the spiritual component of our own dimensions of wellness. There are genetical causes of mental illness. It can be inherited. And sometimes when we are looking at family maps or families within different genealogies, you can see that your grandparent committed suicide or had major depression. Two of the children, a son and a daughter, one of them committed suicide and the other one had bipolar that used to make them not be able to be productive. And now you realize in your generation that you also have a depression. Those are inherited traits. They can be traits of certain patterns, families where women don't get married, or even men don't get married, or families where there are those mental illnesses that are moving from one generation to the other, families where people throw tantrums of anger, families where people are very passive, they hardly express, and they say they are dignified because they do not express themselves. That may be very negative. But again, a mental illness may be caused by negative life experiences, a traumatic experience that you go through, or even an environmental exposure. It can be viruses or toxins, or even alcohol or drugs, or even hormonal imbalances. And so the brain chemistry is affected. All those are causes, and it's important to understand what is causing your imbalance. What is causing your boss's imbalance? What is causing workers within a particular division? Because sometimes particular units get more stressed. Maybe that can be the marketing division or even the IT division, because they are required to make sure that things are working on a moment-to-moment basis. Therefore, their energies are consumed very, very on a moment-to-moment basis, high energy levels. And because of that, those can be units where there is a lot of stress. We also need to know how do they get taken care of, because organizations can pick some units where more stresses have a way of getting generated so that they can also, the organization can have its own way of making sure that the workers are provided with care. This is organizational care, even as they provide themselves with care. This diagram here, it is a diagram that was generated by a theorist called Newford. And Newford was looking at attachments, and we are looking at relationships in this particular presentation. And he talks about roots of attachment. The deeper attachment leads to deeper vulnerability. The more attached that you are, the more you can allow yourself to be vulnerable and to share deeply and to expose more of yourself so that you can be supported much more. And so what Newford says is that there are different aspects that make people to feel at ease, to feel they can let themselves be. And they do that if they feel they have belonging and loyalty. And because he did his scientific researches with children, when a child has belonging, has the perceived belongingness that I belong here, I am received, I am cuddled, I am listened to, I am taken along, I am taught activities that I need to do. When I ask questions, I am responded to. That child generates loyalty and they feel they belong. And at the same time, in your organization, organizations that do that they are not unnecessarily preoccupied with defending themselves, but can listen and say, I think there we need to look into it. All of us, we are a unit. All of us are a system. We need to look into it and see what aspects that we need to address. When a child does not perceive belongingness, because they are always pushed away, go out, go and pray with the rest of the other children. You know, even the tone that we use, the pitch that we are using, the words that we are using, can tell a child whether they are needed or they are not. Can tell a worker whether they are needed or not. Can tell other people within communities whether they are needed or they are not. Also love, that how we handle people, they perceive love, they perceive care, they perceive protection, they perceive that they are welcomed. They are not given conditions to be received and to be loved and to be taken care of. There are no conditions. And so whether they are the children where love is not conditional, because you have shouted at another child, then you're not going to be loved. You can say you're not going to be given food because it's a way of training you not to do certain things. But when it comes to love, they need to know, I love you, but I need you to be disciplined for you. And even the way I am explaining it, the child will know I am not angry because I am differentiating the child from the action. And the senses too. Like when you go and sing lullaby to a child and you're holding the child, what you're doing is that you're soothing the child. You're making, if you greet another worker with a warm handshake, They will even say, my boss greeted me with a warm handshake. I know I belong. I know I am important. My boss looked at me with eyes of, you can do better because you have what it takes to do better. And therefore, even our non-verbals should communicate exactly what can be helpful. People need to feel significant. Do you make people feel significant? Do you make people feel that they are important? Do you help your children to make other people feel important, or do they make them feel unimportant? Because we are also training others and mentoring others and cloning others to be able to survive in a world that is very demanding. So that significance is important. And I was listening to our son, who is a young lawyer now, who was entered into the bar last year and now has started his own farm. And there are people, there are those in pupillage that he's taking care of. And he told me, I would want, they are looking up to me because I can mentor them. And because they are in two places. Even the one who is far away in another center, I reach out in the morning to ask, what are you doing? And I felt a sense of appreciation that he can do that he considers other people to be important, that he does not dismiss them. He does not look down on them. He does not think that he's the only important element that can be there, that he knows that we live in communities where we need to allow people to perceive themselves to be important. Sameness. If a child feels they belong and they feel loved and they feel that you take care of them and you not really pampering, but you make them feel that they are important even in the way you greet them, you hug them, you handle them, then they develop a sense of sameness. I want to be like you, mom. And I want to be like you, auntie. Uncle, I want to be like you. I want to be a boss like you. I want to look at you. You are important. Look, so many things that I would want to do from you. There are the fruits of attachment according to you. This emergence, you can be creative, integrated. You can adapt. You can adapt to situations, even situations that are very hostile for you, but you can adapt to those particular situations. This is Maslow's hierarchy of needs. And in our workplaces, we need to help people to be able to fulfill these needs. The basic needs, the need for they can have on safety needs, they have security, even in their departments, they have security. They have a sense of belonging and love. They feel loved, they feel appreciated, they feel taken on board, they feel included. A sense of esteem. There are times when rewards are given. And I know, and I have seen in the insurance industry, you do that prestige and feeling that one has accomplished, but it can even be a task where you as a board, you are saying, well done, you have done it all. Come, authorization that they can actualize achieving their own potential in their department, in their job roles, in the functions that they are carrying out, that they have a sense of fulfillment they have gone board that they are doing that for workplace. They are also doing it for themselves. When it comes to like where we are coming from, people can have injuries that come from the past. And this can be caused by adverse community environments. It can be a lot of discrimination. There is community disruption, lack of opportunity, poor housing, quality, and affordability, a lot of violence. Then you can also have gone through adverse childhood experiences. It can be maternal depression, incarceration, or even mental illnesses, or even divorce, or even physical or emotional neglect. All these things can make us now develop mental health illnesses. I want now to conclude it in what I've said. I want to conclude with the to and experiences as a child, then what happens is that one develops disrupted neural development. And then there is social and emotional and cognitive impairment. And there is adoption of health risk behaviors. The way you drink alcohol, the way you use marijuana, the way you're using mugoka, and even cut. That there is a way you jump out of your desk and go to the toilet so that you can chew a little bit of the cut for you to feel that you are yourself, or to feed your neurobiology. And then there is disease. It can even be sexual behaviors that are very promiscuous. Yes, you try to hide them, but they are there. You actually need to attend counseling so that you can be well. Then there is disease, disability, and social problems, and early death. For people who have gone through adverse childhood experiences, they meet their death when they are very young. Yes, in our workplaces, there is how we attach ourselves, and we talked about it. And it is important to see how you attach. Are you fearful? Are you avoidant? Are you anxious? Are you preoccupied? That when you're seated on your desk, someone will say, and you look very preoccupied, and you've been preoccupied from the time you reported here. Some of this can come from inconsistent parenting. It can come from where we came from, our origins. Even this fear and being avoidant is about feeling I'm not worthy. And therefore, even approaching the boss or approaching your boss, and your boss keeps on telling you, why didn't you come to tell me that? I would have been of assistance. And then you say, I'm very fearful. And your boss says, I know you are avoidant, but it's coming from a place. And also that you can be very dismissive. And this may be because you had a parent who failed to meet your needs emotionally. So you dismiss. It can be you as a boss who is very dismissive of others and what they are going through. I remember when I was in high school, our head teacher telling us, telling a teacher who was asking for permission to go and bury a relative, that if they're going to be pall bearers, if they're going to be carrying the coffin, that's the only reason that can make the head teacher to actually provide permission. Okay, but the best place to be at is where you are secure. The best place to be at is where you are secure. And you need to make sure that you work on yourself so that your relationships with those in your department, in your workplace, they are secure. Right. I'm not going to explain that. There are traits that are very damaging in relationships, and we talked about them, but let me mention them. Being critical, blaming, complaining, being nagging, and threatening, and punishing, and bribing, and rewarding to control. That you are rewarding a particular worker so that you can control them. But we have the different types of mental disorders, whether you suffer from anxiety or you suffer from impulsivity, that you allow other people to be dependent on you without thinking. When they become dependent, don't I disable them? Or even you yourself, you can be a dependent. Impulse control, meaning we cannot stop our impulses from doing particular things, or even having eating problems, or even mood disorders, or even having schizophrenia, the person that we said is psychotic, the way they think, the way they treat themselves, you can see it is disconnected with the reality as we know it. And personality disorders, and there are many different personality disorders. And we have workers who have all the different kinds of disorders. I think this can be a topic on its own so that we can understand disorders and what to do about disorders and how you can make sure that you're working on yourself so that you can be well regulated, so that you're not in the extremes. One of the temperaments that we talk about is you can be choleric, you can be melancholic, very organized, sometimes perfectionistic. You affect other people with your being perfectionistic, or you're always loading work on yourself and other people, choleric, or you're sanguine, always happy, forgetting things sometimes because you get distracted a lot, but you are a happy person. And even people in workplace love you, even in the family. But sometimes even completing tasks becomes difficult because you get disrupted. Or even pragmatic, very fearful, not sharing your own emotions with other people. Again, it's good to know the areas you need to work on. And the post-traumatic stress disorder, you have gone through an experience and you think it's still impacting on you. So how do you get out of these challenges? If you delay too much before you seek for help, and mentally now you're very delusional, you're not able to align your thinking with the reality, you cannot benefit from talk therapy, then the first place to be at is with a psychiatrist. You're going to be given medication, but it's also important to know that medication is not going to get out the causes that made you to have psychosis or to have depressions. whatever depression that has been diagnosed, you still need psychotherapy, you still need counseling, you still need a counseling psychologist to sit with you, to help you to think out, to help you to explore what is happening to you. And you may require a support group. 2 weekends ago, we were launching the bipolar psychosocial support association. And that is going to be very instrumental. And because I was the key guest, I said, let it be a movement. Let it go to all the towns. Let it go to all the counties. Because people who are suffering mental unhealth, they need support groups where they can support each other. They need psychosocial support. They need even families who are careful to know what a person who is going through mental illnesses require. Tips to improve mental health in your workplace. Talk openly about mental health. Provide mental health days like what we are doing. It may not be a day, but there is a sensitization. Be inclusive. Do not exclude. Be attentive. Keep the conversations going even when things are not working. Foster a mentally healthy workplace. Be discreet when it comes to employees' privacy. Do not highlight them. Ensure resources are relevant. Provide easy access to resources and be positive. Point people to where health really is. It is 26, that is 9:26. We only have 4 minutes for question and answer.
Great. Thank you so much, Daktari. Thank you for that very, very elaborate session with very clear insights, including coping mechanisms. I have a question, too. One is, how do we deal with the effects of technology on children mental wellness or mental health? That is a question. And then there's another one on how do I deal with uh, people pleasing behavior in handling relationships. You can answer that as I try to see if there is any other question.
Thank you so much, Roima. Technology and children mental health. I have written a book on effective parenting in the 21st century. And in that book, there is a section on technology and children. And what I'm saying, the key thing that I am trying to communicate is that you cannot take away technology from children, that's for sure. But then we need to help them to use technology in a healthy way. In terms of what is a period of time that a child needs to be on the phone or the child needs to be connected with technology, because they also need to connect with themselves. They need time for connection with themselves. And when you look at research is saying, actually, unless a child is doing some study, and therefore they have to connect with technology because of some information that has to do with improving themselves in studies. All areas of technology, they should not actually do an hour of that, more than an hour or more than 2 hours of that. Regulating technology, and also as a parent or caregiver, helping the children to see dangers of technology. One, they consume them. And therefore, they are not able to have a good connection with themselves where they can reflect on who they are and what they want and how they want things to be done, because they are always connected. And also that when they are having relationships that they only communicate with through their phones or through the social media, there is a way they deny themselves connections that are very important in helping them to attain also physical health. When we connect with other people, there is a way that helps us in improvement of our own health. I am seeing a question from Lisa, but let me first of all respond to the people-pleasing behavior. The people-pleasing behavior is an aspect of low self-awareness and lack of boundaries, that you do not know where other people reach and where you start, or where you start and where other people reach. You are not an agency to yourself. You are not a driver to yourself. You do not look at your needs. You prioritize the needs of other people much more than you prioritize your own needs. Codependency also, that question, I can connect the codependency with what I have seen flipping there, because codependency is about depending on others for your own survival. Remember, other people cannot give you survival. Only you can give yourself survival, or only individuals can give themselves survival. And so what we need to help them to do, because workplaces are not meant, okay, we have departments for mental health, but then what I am saying is, whether it is in workplace or even alternative support, like how KIPCO provides you with therapies, so that people can be helped to individuate. People can be helped to know themselves. People can be helped to be confident with themselves. People can be helped to have their own identities, to become their own entity, because they need to be entities by themselves. But when they do not know themselves, they don't do a SWOT analysis of themselves. Even when they are choosing marriage partners, they choose marriage partners based on their whims, based on emotions, and that is how marriages crash, because you didn't think. Marriages should be like a project you are getting into. And just like when we are getting into a project, we are very clear of the cost-benefit analysis. Is this a person who is going to be more costly to me than beneficial to me? Get away from that. If you're going to be paying more costs because someone is throwing tantrums, more costs because someone would even shout you down in public, how on earth would you try to couple yourself with that kind of a person who has not worked on themselves, who is thriving in immaturity, and they are happy with being immature? Anyone who wants to get into a relationship needs to do their own work to mature themselves, so that within a relationship of marriage or partnership, then they can do their own bit that they are supposed to do. They can actually make sure they are responsible. Yes, so I think, Jemima, the questions can be many.
Yes.
And we
So
might.
there are good. There are some good comments. Thank you a lot, Professor, for a very good educational presentation. I have something from this, and looking forward to using your tactical ways to help me get along with people around me. That's a comment. And then there is another comment. Someone said they will now relate well. Thank you for the wonderful session. I'll be sure to provide support to those around me, and not being a okay, I've lost it. Not being not cause emotional distress. So yeah, there is a question, and maybe it's the last one that Dr. You can briefly just comment about it so that we can close. How do I handle a child who throws tantrum? Referring to a 5-year-old. That one you can just briefly comment, and then we can give directions to where to find you.
Right. Okay. A child who is throwing tantrums, and they can throw tantrums even when they are 1 year olds. And this means that they are not managing their emotions very well. And you as a parent need to help them to be able to identify you are angry. And when you are angry, you need to understand what is causing you to be angry. And so the question that you ask is, what has made you to be angry? And so the child is going to explain you, my toy has been taken, and when someone else takes a toy from you, then you either can mentor or coach. There are 3 ways or there are 2 ways in which you can handle it. You can go to the child and say, the toy belongs to me, give it to me, or you can learn to an adult who is going to help you to be able to resolve the conflict. But what you want the child to do is to calm down and to listen to their inner self. Sometimes, even when we are employing, if you have a child who is throwing tantrums and you employ a house girl who also does not know, who is very reactive and does not have a calming effect on the child, that again affects the child a lot. And so even when you're looking for a house girl, and I know they are not plenty, even when you're looking for a caregiver, you have to know the temperament of your child and match the personality of the caregiver with the temperament of the child. For a child who is throwing tantrums, you need a house girl who is better grounded, has ability to control their own emotions, and they are kind. They can hold a child and say, come here, now tell me what was happening to you. So we need to talk to the child so that the child can start talking about what is happening to them, so that they can know they don't have to act out their emotions. They can talk out their own emotions and they can understand themselves, and they can now act upon their emotions rather than being reactive to their own emotions. Thank you so much for listening to me,
Yes.
each one of you. I am very honored to have heard you in this particular presentation.
Thank you, Dr. Thank you so much. For the interest of time, someone asked about screening of mental health. Yes, there is a mental health assessment toolkit. That one maybe you would need to speak to Dr. on a separate note to get the details. But I just want to conclude this. It's 9:36, and say thank you for your participation. The Apollo Group team, thank you so much for listening in. I hope you have picked coping mechanisms on how to handle your mental wellness. Remember, Dr. started by saying there's no health without mental health, and therefore it is important to listen to ourselves, to listen to our bodies, and know when to stop and give ourselves good self-care for our mental health and also our physical health. We will share the presentation. I've seen some requests on that so that you can review and check and pick coping areas that you can, or coping tips that Dr. has presented. I also want to say this was a timely presentation just ahead of the Mental Health Month of May. So we have started early, and this is just to boost the awareness about your mental wellness and how it and why it is important to you and also to people around you. We have Professor Catherine Gachutha. We have put her contacts on the chat box. We've also put the location of her offices. She has over 40 counselors, so you cannot afford to suffer alone. She has counseling psychologists. She's also one, and so you can visit her facility in town and in various other places around the counties and get help. And you also remember that we have anonymous counselors. Should you want to see a counselor, our HR has provided to us anonymity, and you can be seen and we will not be able to tell that you went to see, and the bills are taken care of in an anonymous way. So feel free if you need any support. The wellness team here at APA Insurance and the care team is ready to assist. Please feel free to visit them and maybe ask questions and maybe ask for directions. You should not suffer alone. Remember, your mental wellness is key. And so we need the whole of the person, the whole of you, even in the workplace. So thank you so much. I will hand it over to the HR team just to give us their final remarks, Yvonne. And from myself, Jemima Mbogwa, and my co-host Zainab, I want to say asante sana and have a blessed day ahead.
Thank you so much, Jemima, for that. Thank you so much, Daktari, for the wonderful presentation. We've learned so much. We hope we'll be able to have another session with you. This is not the last one. I'd like to appreciate the care team, Jemima, Zainab, and also the HR team, Sandra and Ruth, and also Beth for enabling put this together with Rosemary. So as we close, I'd just like to say that we need to know that mental health is a journey and not a destination. Let's continue to prioritize our self-care, seek support when needed, and cultivate resilience together. Thank you for joining us. And remember, you are not alone in this journey towards better mental well-being. Take care and stay strong. Have a good day and see you next time. Thank you.